হ্যালো ফিউচার নার্সেস, ওয়েলকাম ব্যাক টু মাই চ্যানেল নার্স প্রফেশন বাংলা। আজকের প্রথম কোশ্চেন, হোয়াট ইজ দ্য ফার্স্ট প্রায়োরিটি হোয়েন প্রোভাইডিং ফার্স্ট এড টু অ্যান আনকনসিয়াস ক্যাজুয়ালিটি? Answer: ensure airway patency. Maintaining a clear airway is the first priority in an unconscious casualty because airway obstruction can rapidly cause hypoxia and may lead to cardiac arrest. Second, what is the most appropriate first aid measure for severe external bleeding? Answer: apply direct pressure. Firm direct pressure over the bleeding site helps compress the injured blood vessels and is the immediate method to control severe external bleeding. Third, which position is most appropriate for an unconscious patient who is breathing normally? Answer: recovery position. The recovery position, side lying position, helps maintaining airway patency and allows vomitus or secretion to drain from the mouth, reducing the risk of aspiration. 4. What is the recommended first aid treatment for a minor thermal burn? Answer: cool under running water. Cooling the burn with cool running water helps remove residual heat, reduce pain, and limit further tissue damage. 5. For how long should a minor burn ideally be cooled with cool running water? Answer: 20 minutes. Cooling the burn under cool running water for 20 minutes helps reduce pain, swelling, and ongoing tissue damage. 6. Which action should be avoided when providing first aid for a burn? Answer: applying butter or oil. Butter or oil can trap heat in the burn tissue and increase the risk of infection. 7. What is the first aid measure for a nosebleed? Answer: sit forward and pinch the nose. The person should sit upright, lean slightly forward, and pinch the soft part of the nose continuously. This helps control bleeding and prevents blood from entering the throat. 8. In which direction should the head be positioned during first aid for epistaxis? Answer: forward. Leaning the head forward prevents swallowed blood and reduces the risk of blood entering the airways. 9. What is the most appropriate first aid measure for a suspected fracture? Answer: immobilize the injured part. Immobilization prevents further movement of the fracture bone and reduces pain and additional damage to surrounding tissue, nerves, and blood vessels. 10. Which device is commonly used to immobilize a fractured limb? Answer: splint. A splint is used to immobilize the injured limb and maintain it in a stable position until definitive medical treatment is available. 11. What should be done first in case of suspected spinal injury? Answer: keep the spine immobilized. The spine should be kept immobilized to prevent movement of the vertebral column and avoid further injury to the spinal cord. 12. What is the first aid management for a sprain? RICE, CPR, FAST, ABCD. Answer: RICE. RICE stands for rest, ice, compression, and elevation. It helps reduce pain, swelling, and inflammation following a sprain. In the RICE method, the letter I stands for answer ice. I stand for ice. Applying a cold pack during the initial period helps reduce pain and swelling by causing local vasoconstriction. 14. In the RICE method, the letter E stands for answer elevation. E stands for elevation. Raising the injured limb above heart level when appropriate helps reduce swelling by promoting venous and lymphatic drainage. 15. What is the most appropriate first aid treatment for a closed soft tissue injury during the initial period? Answer. Apply cold compress. A cold compress helps reduce pain, swelling and bleeding into the injured tissue during the initial period. 16. Which is the most important first aid measure for choking in a conscious adult who cannot speak or cough effectively? Answer. Perform appropriate choking maneuver. A conscious adult with severe airway obstruction who cannot speak or cough effectively requires immediate choking first aid, such as back blows and abdominal thrust as appropriate. This helps dislodge the obstructed object. 17. What should be encouraged in a person with mild choking who can cough forcefully? Encourage coughing. If the person can cough forcefully, the airway is partially obstructed. Encourage effective coughing because it may expel the foreign body naturally. 18. What is the first step when an adult collapses and is unresponsive? Answer. Check responsiveness and breathing. First, check whether the person responds and assess normal breathing. If the person is unresponsive and not breathing normally, activate emergency help and begin CPR. What is the recommended compression rate during adult CPR? Answer. 100 to 120 per minute. High quality adult CPR requires chest compression at a rate of 100 to 120 compression per minute. This rate helps maintain adequate blood flow to the brain and heart. 20. What is the recommended chest compression to ventilation ratio for a single rescuer performing adult CPR? Answer. 30:2. For adult CPR, a single rescuer performs 30 chest compression followed by 2 rescue breaths. This 30:2 ratio is used for adults with no normal breathing. 21. Where should chest compression be performed in an adult during CPR? Answer. Lower half of the sternum. Chest compression are performed on the lower half of the sternum with the hands placed in the center of the chest. 22. What is the recommended chest compression depth for an adult during CPR? Answer. At least 5 cm. Adult chest compression should be at least 5 cm deep while avoiding excessive depth beyond about 6 cm. Adequate depth is necessary to generate effective blood circulation during CPR. 23. What should be done immediately after an AED advises a shock? Answer. Ensure everyone is clear and deliver the shock. Before delivering an AED shock, ensure no one is touching the patient. Clearly announce that everyone should stand clear, then allow the AED to deliver the shock. What is the primary purpose of an automated external defibrillator? Answer. Deliver a defibrillation shock when indicated. An AED analyzes the heart rhythm and delivers an electric shock when a shockable rhythm such as ventricular fibrillation is detected. It can help restore an effective heart rhythm. 25. Which sign is most characteristic of shock? Answer. Cold and clammy skin. Shock commonly causes reduced peripheral circulation and sympathetic activation, resulting in pale, cool, and clammy skin, often accompanied by rapid pulse and weakness. 26. What is the most appropriate general first aid position for a patient with shock who has no breathing difficulty or injury requiring another position? Answer: supine with leg elevated. Traditionally, a person with shock may be kept lying flat with legs elevated when there is no contraindication. 27. Which is an early sign of hypovolemic shock? Answer: tachycardia. Tachycardia, rapid pulse, is an yearly compensatory response to blood or fluid loss. The body increases heart rate to maintain cardiac output and tissue perfusion. What is the most important first aid measure for a patient with severe bleeding? Answer: apply direct pressure to the wound. Firm, continuous direct pressure is the primary first aid method for controlling severe external bleeding. It helps compress damaged blood vessels and reduce blood loss. 29. What should be done with an impaled object in a wound? Answer: leave it in place and stabilize it. An impaled object should not be removed because removal may cause severe bleeding and further tissue damage. 30. What is the first aid treatment for a chemical splash in the eye? Answer: irrigate the eye with plenty of clean water. Immediate and continuous irrigation with plenty of clean running water helps dilute and remove the chemical, limiting further damage to the eye. The eye should not be rubbed. Thank you for watching and subscribe Nurse Profession Bangla.